Back to school season is upon us.
And that means COVID-19 cases among children will most likely be on the rise once again. And Channel 8's Matthew Mittleider has the details in our top story tonight.
As back to school season draws nearer, many parents are again starting to wonder about the safety of their kids in regards to COVID-19. Over the past 2 years, we've seen spikes in both cases and deaths towards the end of the summer and moving into respiratory virus season. Near the beginning of the pandemic, kids seemed to do better against the virus with only 2.5% of new infection cases. But with major variants like Delta and Omicron, more recently that number is up to 13.7%. I spoke with Dr. Alice Sato, an epidemiologist and assistant professor at UNMC, who said she recommends the layered approach to protection from COVID.
Among the things we recommend are vaccination and being up to date, wearing a high quality mask, avoiding crowded indoor poorly ventilated areas, and staying aware of the rate of transmission in the community.
Dr. Sato says vaccines are available for children 6 months and up from both Pfizer and Moderna, and they are both mRNA vaccines. She says the vaccines are simple and safe, only containing about 7 ingredients.
They contain the mRNA itself, or messenger RNA. They contain 3 types of fat or lipid that encircles them, and then salt and sugar, basically. So they're very simple chemically.
Most of the vaccines are 2 doses given 3 to 4 weeks apart, but for younger children the dosage amounts are smaller. There are also boosters available to children 5 and up and for children that are immunocompromised. Dr. Sato says she and everyone in pediatrics appreciate that parents want to do what is best for their child to keep them safe. She says because it's relatively new, some parents are worried, or they think the risk of the vaccine is worse than the risk of COVID itself. But in reality, a COVID infection is still a top 5 cause of death in children and has been for months since last school year. Even if it doesn't kill, it also leads to ER visits and hospitalizations.
The other doctors I work with have all felt confident in having their children or grandchildren vaccinated, even in the youngest age group. So we really think that these are safe and effective vaccines, and we recommend boosting.
This is Matthew Mittleider, Channel 8 News.